Hi, and welcome back to Your Health Transformed. I'm Dr. Hamilton, your host, and I'm really excited to invite Rachel Gainbrugh. Did I pronounce it right?
Perfect.
That's great. I'm so excited. I'm glad you're here. Like when I saw your topic about how healthcare professionals can almost become whole by doing investments in Airbnb and achieve freedom that way, I thought this was a really interesting topic. So for all my typical listeners, normally I talk about a lot of healthcare topics in regards to patients, but one of the reasons I thought this was important is because Rachel is a healthcare professional, and I think it's important for healthcare professionals to also have other outlets and other ways to develop freedom in different ways. And so I felt like this was a great topic that could be relatable to a lot of different people. So welcome to the show, Rachel.
Thank you so much for having me, Dr. Hamilton. And I so appreciate the content that you put out there because, the mental health wellness is also important. I know that's something you talk a lot about, but financial health is wellness too.
I agree.
And so once some of that is in order and you have a little bit of that margin, it feels different. So thank you so much for sharing the content that you have out there for everyone.
Yeah, well, no, thank you. And thank you for being here today. So your background is a pharmacist, right? So tell me kind of what is or was kind of your day-to-day duties, and then how did you kind of get interested in what you're doing today?
Yeah, absolutely. And so I think the pharmacists, I call them the first line oftentimes, especially when you're working in a retail setting. Mm-hmm. And so, of course, like in medicine, there are multiple settings where you can work. You can work at your big box grocery store or a retail pharmacy storefront, or in a hospital basement, or at big pharma. So there are so many places that said the basement.
You called it a basement. That's hilarious because so I work in a hospital, and they do, for whatever reason, stick these pharmacists in the basement. They have there's no windows, there's no nothing. It's almost like so dreary. But anyway, sorry. So go ahead.
Right. I was telling the truth, right? The basement indeed. And overall, I did find that the most lucrative place to work, if we want to talk about what those paychecks look like, it was in the retail setting where they were driving the highest amount of retail revenue. So, not to name any names, but like a pharmacy, you're going to pick up a prescription at a pharmacy. That is your retail setting. But it was the most high stressful, if you go there right now, there's a long line of individuals waiting to pick up their prescriptions, whether it's a refill for their, long-term medications or ambulatory care type meds, or whether it's, an acute situation, they just left the hospital and there's a long line of folks waiting. And oftentimes we found ourselves to be very much understaffed. There were refill requests we left for the physicians to, update something or provide an additional refill. They're coming in. So those phone calls are coming in, the drive-throughs dinging. Correct. And then your one bit of help, they need to clock out because there are so many hours they're allotted to work. So it came to a crescendo, especially with COVID, because when you have the medication, the testing, and then the administration of vaccines also. And again, you're that first line. There are individuals coming in and you can clearly see 911. No, don't come here. You see them from a while away and say, you don't look good. Go, 911. Do not come into the pharmacy. There's nothing we can really do for you here. They would prefer to just come and get that quote unquote free healthcare consultation, but you tend to refer them. So you're juggling all of that, right?
Yeah. And I just want to point out, not to interrupt, because most people don't think about the pharmacist. So I just want to highlight this because, to be honest, I feel like, especially through a lot of the pandemic, a lot of the focus was on first line workers, but that only included EMS, fire department, nurses, in that order, probably, then doctors. And to be honest, the pharmacists, for the most part, were kind of left out of the equation. So I just want to honor this field, because look at all the things that you just mentioned right now that I didn't even think about. Whenever I call in, and which I just did earlier today, prescriptions, for my outpatient clinic, they went to a pharmacist, and a pharmacist has to fill those. And so, there's a lot of input from different things. And you're right. I got my vaccine from a pharmacy inside of a store. And then my next one was CVS or Walgreens, because you guys were the hub for that, for vaccines when they first came out. And then also a hub for testing, right? And at one point they were offering free testing through the pharmacy. So you guys set up drive-throughs or whatever. And I just want to throw out there, because I feel like there was not enough thankfulness and gratitude given to the pharmacist. Focus was mostly on EMS and firefighters, which are great. You know what I'm saying? But truly, the pharmacists had a huge role in the pandemic and still do in overall healthcare. And I feel like that needs to be recognized more. So I appreciate you highlighting that, because when people talk about burnout, they mostly think of nurses and doctors, right? And they don't really highlight from a pharmacist standpoint. And so you just mentioned two things that I didn't even think about until you mentioned it. Over the pandemic, you guys used to just dispense meds. And then you guys became responsible for those two additional, but it was huge, a ton more traffic. And not only that, but as somebody who was treating COVID in the hospital, they had a laundry list before of vaccines that we'd be go get this from the, for the ones who ended up being outpatient, that they had to get from the pharmacy, and managing all that, because you didn't want those patients coming in with COVID, picking up their prescriptions. So that had to be a whole policy thing with a lot of the pharmacies, but they would end up getting a lot more. It's not just an antibiotic. They were giving, certain vitamins, certain, antivirals. It was just all this stuff. So I didn't want to interrupt, but thank you for highlighting that, because I even misplaced some of this. And I just feel like I want to give credit where credit is due. So thank you.
Oh, thank you so much. Yeah, I so appreciate it. And so the whole pharmacy community as a whole, we believe it's a team effort, and we love working with our physician counterparts, our nurses, our medical assistants who take our calls. And so I really appreciate you honoring us, because you're right. We do tend to be forgotten. I remember, I think there was a coffee shop or someone giving out first responders
free coffee. Yes, Starbucks. Yeah. I was in that line almost every day.
We weren't incled.
Yeah,
we had our association say hello.
Yeah,
remember pharmacists too. So you're right. We are often forgotten, but we are very much a part of the community where we do see quite a bit of the patients in the community. We're almost that first stop before they go to urgent care, before they go and see their primary. And so, thank you so much for that. But as you can imagine, that really put a toll, because a lot of pharmacists, they have their own families that were getting ill. They were themselves getting ill. The technicians were getting ill, and then you had to shut down. So all of that was occurring. But I think it really came to a crescendo over the years. It was a combination for me personally, if I could just tell you personally, it was a combination of the opioid situation. That's something that the
crisis.
We were intimately familiar with. Unfortunately, there were some misprescribing, some of those physicians who were kind of the bad actors, sending out multiples of prescriptions with family members of an individual, and 3 or 4 of them, they would come to the pharmacy, oftentimes belligerent, and at one point I thought to myself, you know what? Everything I learned in school, Dr. Hamilton, this wasn't it. Nobody taught you how to combat. You can identify, what's a forgery, but just day after day after day. And so that's been an interesting development to see what's going on with that. But it was a combination of those things that kind of pushed me towards going into an IT setting. So I was doing pharmacy IT setting, and I still consult for them every now and then, but I am glad to be semi-retired from that type of grind altogether, the retail setting and the
let me add on to that too, because you're right, opioid crisis. So before that, my pharmacy friends used to call me, because now there's a system in place where physicians can look up the data. That hasn't always been. That may be over the last 3 years, honestly. That was not always in place. So a lot of times as a surgeon, especially when I would write pain meds or whatever the case may be, or in the ER, because I also take ER call, I would get a call from pharmacy and say, hey, do you know this person just filled something, some opioid like 2 weeks ago? Are you sure you want to prescribe this? And I had no clue. So I also want to throw that out there, because it was the pharmacists that were essentially responsible. And I will say responsible because the physician doesn't know. We didn't have that information readily available, but it was the pharmacist that was responsible for tracking what medications this particular person picked up, even if it was from other locations, even if it was from other physicians. So some patients may go to different doctors for the same thing. And these controlled substances, if I was a physician and I do weight loss, handing phentermine, for example, but then this patient is also getting it from this other doctor. At one point, I had no way of checking that. And so that also fell on the pharmacist's responsibility to make sure they don't duplicate certain medications and they're not doctor shopping or getting it from a different doctor. So I just want to highlight another very important role before pandemic, which is what you were alluding to. That was a purely pharmacy responsibility. That was not the physician. So I just want to highlight that too. And I can see how that can be overwhelming too, especially for people who needed certain meds, and they just kept going to different, almost like what we call doctor shopping or even hospital shopping. They had to keep all that together too. So I can see how the combination of having already to do that, and then with addiction and mental health getting worse, that probably got worse. And then the pandemic. And then now you're like, we have to give out vaccines and we have to give out all these, medications and the tests, et cetera, et cetera. So, I mean, burnout's real and it can happen in any healthcare profession. So you transition to IT, and then how did you get into this almost like Airbnb phase? Because that is super interesting for me.
Yeah, absolutely. And so I've been loving the IT side of things. And like I said, I still consult. But for me, it was actually the culmination of, getting past a big whopping student loan debt.
Yeah.
That my husband and I had, he does psychotherapy. So we walked away from school with a lot of student loan debt, close to $500,000.
Yeah, I'm still paying mine.
Yeah. Yeah. And so I decided, you know what, let's buy back some of our time and not necessarily just, continue on the path of not having enough savings, and was kind of concerned. We had a couple kids at that point. Yeah. And so I did all of the research to identify, well, what would be the highest leverage activity that I can engage in that would, give me back some of that time for, I didn't want to buy a whole other job. So I dabbled with, trying to figure out a little bit more about real estate. And I looked at Bitcoin, I looked at all the things, but real estate really stuck because I kind of felt like it was easier to understand. You can touch it, you can see it. I get real estate, but within real estate, there's so many aspects, right? There's buy and hold long-term rentals. There's syndications where you're investing with other investors. There's wholesaling, but we wanted to be strategic. Yeah. I had already worked, 3, 4 jobs, 5 jobs between the two of us, moonlighting everywhere. I didn't want to buy another job. I wanted to invest in more of a lifestyle asset, something that not only would I be able to. My dogs are howling. I'm so sorry.
No, that's okay. I can't hear them.
You can't? Okay, awesome. No. Yeah. So not only could I generate revenue, but something that I can also enjoy as well.
That's key. Yeah.
Yeah. So that was really important for me. And so I'm going to be different from any of the other real estate gurus that say, you need 20 houses to get to financial freedom. My goal was, how do I own and operate the fewest number of properties that generates the highest profitability? So that was my goal. And with Airbnb investing, especially if you position the property as a luxury travel property, all you need is 1 or 2 really to be wildly profitable.
Really? And so where are you located in the world?
So I'm in Georgia.
Okay.
My rentals are in Georgia, Florida, Tennessee, and Pennsylvania.
Oh, wow. So you're all over. So you probably started off small and then now you're growing.
Exactly.
And so what do people do about these? They're cracking down, I feel like, on Airbnb and the laws and who can have one. I'm in Texas and I have a rental in Virginia that I just looked into because I I thought about Airbnb because I like real estate. And I was like, if I wasn't a doctor, I'd be interior designer because I like decorating and doing different things like that. So naturally for me, I'm like, okay, that seems interesting too. It could be part of my lifestyle, but they have all these rules and laws against Airbnb. So how do you combat that? Or did you get in before all that?
Well, you know what, whether you got in before all that, it can still be impacted, right? And
Yeah,
so
okay.
that is something that is very key on your initial process when you're searching for a market to invest in. You want to make sure you understand what the regulations are, as well as the future regulations, because a lot of things are in the draft
Okay.
process as well.
And you
So
can look that up pretty much,
you,
or
you
okay.
can call the county clerk's office and you can look it up and they'll let you know
Okay.
what's in draft at the moment.
Okay. That's
You
good to
can
know.
ask that directly. Yeah. So I do recommend you look up the Municode or the municipality code. You can Google that. If there's nothing there, everyone I interact with, I tell them then pick up the phone and call the county clerk and ask them what is there in draft, and they'll send you a copy of whatever is in draft. So you can start to get a temperature check of what that that environment is going to be. Rule of
Okay.
thumb, of course, though, is if it's in a traditional vacation rental market, you're good to go. It's
Yeah.
when you're in the suburban areas, you do want to double and triple check and understand what those regulations are going to look like going forward.
Okay. So then if you're in a traditional vacation area, say like Florida, I'm
Yep.
sure they have several, like
Oh,
how do you
yeah.
compete? Like well, that's my second question. The first question is how do you afford to buy? Because you have to buy the real estate, right? Like that's kind of first step. Well, after the municipal check, maybe, and you
Yeah.
find a location, you have to be able to afford to buy it.
Absolutely,
Yeah.
absolutely. And so one thing that I leverage, and I'm not a financial advisor. I feel like my hair is doing this thing. And, we're not attorneys here, but I actually leverage something called like the 10% down vacation home loan.
Okay.
So using
Okay.
that, I'm able to get, great properties that maybe they're not like turnkey, but I can do a few things to them to get them up to par. So if I can
Okay.
tell that it can provide a vibe like, oh my goodness, this backyard, I can maybe build a little fire pit and
Yeah.
turn it into something, because the luxury traveler, and I focus on luxury, and here's
Mhm.
why, and that's why I don't compete. I live in like the blue ocean instead of red ocean. There's no feeding frenzy. I make sure I'm like the top 10% of my market because of the value that I'm adding to the property, and it doesn't have to break the bank. So
Okay.
10%
Got it.
down, I'll go in and redo some flooring if there's carpet, because pet friendly is definitely one of the amenities that has allowed us
Mhm.
to get greater than 30% of our revenue.
Okay, good,
Yeah,
good.
so pet friendly is really important. So the way you want to stand out from the crowd. We use professional photos. We have like kind of a design scheme that we like to use, but understand that the luxury traveler, they're just so much more different than, your traditional luxury, amenities. Modern luxury is all about just really about the vibe, really feeling like you're living like a local. That guest wants to live like a local. They want to connect with nature. They want to
Yeah.
connect with those in their party, that they're there with. And if you can kind of curate that space to speak to that, you're golden. And so
Okay.
that's really what my goal is to kind of create these experiences for our guests, and you market it, you talk about that in the copy,
Yeah.
but understand that Airbnb is the Google of travel,
Correct. It is.
accommodations.
Yeah.
And I know that there's like a lot of consternation about it, but it's not going anywhere.
Yeah.
Airbnb has generating so much more revenue than the Hiltons, Marriott's all put together.
Really?
They're
I didn't
the
know it was that good. Yeah,
It
I can see
is.
that. I can see that.
So it would behoove the municipalities to create rules that are fair around it.
Yeah.
Unfair regulation is not good, but I'm not afraid of regulation.
Yeah.
I like to go into a place where there's regulation, because there are clearly defined areas and roads where you can operate and clearly defined where you can't. It's when it's kind of fuzzy. I'm not a big fan of that. But if there's regulation, I'm here for it. Then I know exactly where I can play. But all of the municipalities, they're getting their transient occupancy taxes or their
Correct. Exactly.
hospitality taxes.
Yeah, they're starting to tax everything now. Yeah.
They're taxing everything. So, and I'm happy to pay it. And they're really generating revenue. And it's great for small businesses because we refer a lot, all of our guests.
Yeah, correct. That's true.
To the little restaurant.
Yeah, have a list of places that you tell. So you created essentially an experience in your Airbnb. And so at one point now you're able to do this as your full-time job. But before you were a pharmacist and you kind of started doing this on the side. Yeah. Like, tell me, like, as a healthcare professional, like how long did it take for you to kind of get this started and set up? And then how much time, as if you're working a full-time job, like how much time did you have to devote to this when you were doing both?
Yeah, that's a great question. So initial setup, I would say our very first property we purchased in November of 2019.
Okay.
It would take maybe anywhere from 4 to 5 days to set up a whole property. Okay. So it takes some time, but you want to leverage those in your community, whether it's your movers or handyman to come in and help put everything together, set it up, hang up your drapes, hang up your pictures, and so on and so forth. And then as far as the management perspective, it takes us right now about 2 to 3 hours a week to manage our properties.
2 to 3 hours. And how many properties do you have now?
17 now.
Oh my gosh. But you started off with like 1 or 2?
1. You
started off with 1 and then loved it and started. How long did it take from the time? 4 to 5 days is actually not that long. And how long before the time when you opened your first new property to before you started making income from that?
So when we placed it online, we actually had my father-in-law book it for like 2 or 3 nights. So that he and his wife, they were inn owners. They were innkeepers. So I told them, spend 2 nights here and let us know what's missing, what you like, what you don't.
That's a good idea.
Yeah, absolutely. Everyone should do that. Have someone spend the night that's highly critical, or you spend your own night so you can see, have coffee. What are you missing? We booked him for 3 nights and we opened it up and we had to kick him out that first night. We got that first booking.
Oh, wow.
Wow. Yeah, we did. Yeah, we sure did. And the payout is 24 hours after that first guest arrives.
Yeah.
So whenever your guest arrives, you get the payout within 24 hours.
Oh, wow. So you guys started making money almost immediately. And then
I remember the ding coming in the middle of the night, and I said to myself, "This is what it feels like to make money while you sleep." Like,
exactly.
Hilarious. Like at 2 or 3 in the morning, we couldn't believe it, and we were hooked. We're like, "Oh my goodness, we didn't have to punch a clock for this." So we were hooked.
That's awesome. That's awesome. So your goal is to continue to buy these properties, and rent them? Or are you guys good at like the amount that you have now?
Yeah, we had gotten up to we also manage for some friends who are investors as well. We got to 22 and we're down to 17. And so we're more than good. We can go all the way back down and we would be fine. But what we've been doing is like the older homes that we purchased that, have been kind of, we kind of reposition our portfolio, those that aren't performing the greatest. We're doing a tax strategy called 1031, exchanging them to bigger and better homes. And got it. More. Yeah, less is more for sure.
That is so cool. That's awesome. That's great. So you guys have a whole thing now. Now, is your husband still in healthcare or is he done too?
He was done since early last year.
Oh, wow.
Talk about the burnout. So he worked for the Atlanta public school systems, psychotherapy for children. Oh my goodness. Yeah. He got to see some things that, he can't unsee. It was tough on him.
Yeah. Okay. So he's burnt. And now you guys are both doing this like Airbnb. Yeah. So your clientele for these, are these short-term, like a few days, a week type of thing?
So I have a mixture. If I'm in the vacation rental markets, for instance, like the mountains, the ski or the beach, we primarily serve those who are there for 2 nights to a week, so really short term. But the properties that we were purchased that are in the suburban areas, those we stumbled upon a guest avatar, so to speak, that we didn't know was out there. Those are displaced homeowners that are displaced due to, say, some type of catastrophic event that occurred to their home, whether it's a fire or water damage or a storm. And so they're renting from us, and it's initially a 30-night stay, but I've received 11 extensions. So 11 months.
Yeah. Okay.
Yeah, because it takes a while, right?
For those houses to
rebuild a home,
correct,
to renovate, and the supply chain is not always there sometimes. And so we do have a midterm rental strategy, but we focus primarily on the insurance displaced homeowner guests.
Wow. And all of your homes are essentially fully furnished?
Yes.
Okay. And then you guys come in and decorate them. And so when you have all these properties that are out of the state that you live in, you go there and get to know the area, or how does that work when you're searching?
Initially, we did, but not necessarily. It's all about understanding your systems. You know, we definitely have boots on the ground, and oftentimes, believe it or not, it's our cleaners who are so helpful in getting us in the know. They'll call a repairman for us if something's needed, and just they are wonderful. So our cleaning team is really the backbone of our business. They know the properties better than we do. You know what I mean?
Yeah, that's awesome. That's awesome. So here's a little insight. Like, you're right. Wealth and mental health all combined with healthcare professionals. Like, this is another way that you can go get through freedom, happiness, and you could do, like, you guys are now doing this for full time, but it sounds like at 2 to 3 hours a week, this could be something to generate wealth that could just be done, on the side if people want them. They don't have to necessarily, but this is a great time to introduce that concept with everything going on in the market. You know, houses are really expensive now, but it's going to go down. And I think this will be a great way to grab and potential another opportunity for people. So thank you so much for sharing. I think this is a great idea. I'm super excited to learn more myself about this. Thank you.
I can't wait for you to jump on board, because there are also, we didn't speak about this, but there are also some amazing tax strategies for medical professionals as well, and other higher income earners to, get those write-offs for even the furnishings. So definitely.
Really?
Yeah. There's some amazing loopholes for short-term rentals. Yeah.
And that could also help offset some of the cost, right? Because 10% down is great. Actually, it's not, because these aren't going to be your primary home. They're not going to be as expensive, but then to be able to have those additional tax write-offs too for the furnishings. So I'm excited to learn more. So thank you so much. Thank you so much for being on the show. I'm so excited that you were here and able to, give us some insights as healthcare professionals, what we can do, because this could even be an outlet for some of us. Like for me, that I'd love to go. I love decorating the homes that I do have. And mine are for more long-term rental options, but this is exciting to know all these different options that we can do. Thank you so much for being on the show.
Thank you so much for having me. I appreciate you.